Let's start our first question. In this question, look at related percentage. 65% lymphocyte is definitely high, as the normal range is typically around 20 to 44%. So we know there is related lymphocytosis. This eliminates option A. Now we must calculate the absolute count, which is what usually matters clinically. We will look at the formula on the next slide. This slide defines our key terms. The relative count is just the percentage for the differential. The absolute count is the actual number of cells in the blood. The crucial formula to remember is absolute count equal to the WBC count is multiplied with relative percentage. So for our question, total WBC count 4.0 into 10^9 per liter, relative percentage 65%. So absolute lymphocyte count is 2.6 into 10^9 per liter. Now we compare our calculated absolute count of 2.6 to the given reference value 124 into 10^9 per liter. Since 2.6 in the middle of this normal range, there is no absolute lymphocytosis. Therefore, the patient has only relative lymphocytosis, making C the correct answer. This situation often happens when another cell lines like neutrophils is low and neutropenia, which artificially inflates the percentage of the other cells. Question 2 is the key recall question about granulocyte maturation. It is asking for the less or most mature stage that is still able to divide. As we said before, the granulocyte series is split into mitotic and post-mitotic pool. We need to do the last call that can divide. Mitotic pool is clearly includes myeloblasts, promyelocytes, and myelocytes. Myelocyte is the final stage capable of mitosis. The correct answer is C, myelocytes. Progression of primary granulocytes and progression of secondary granule commence with what cell stage? When the cell becomes myelocyte, it stops making the primary granules and begins producing its secondary or specific granules. Therefore, these are the granules that will define it as a neutrophil, eosinophil, or basophil. So correct answer is C, myelocyte. Here we have to find the false statement question about eosinophils. This requires you to know the specificity is the cell type. You can see it's stimulated by infections and allergies. Its granular content, which includes cytotoxic proteins, chemokines, are released to fight pathogens and participate in inflammatory and allergic responses. These confirm their key role against pathogens and allergies as mentioned in the question. They lack lysozyme. Lysozyme is the key component of the granules in neutrophil and monocytes. This is a key difference between the cell types. Our last question is find the correct statement. A is false. The definition of hypersegmented neutrophil have 6 or more lows. C is false. Toxic granules are prominent. Primary eosinophilic granules that have retained their dark stain in their mature cells, which is an abnormal finding. D is false. Those forays are pale blue patches of red endoplasmic reticulum which contains RNA, not DNA. Orals are crucial finding, and we will see in the picture on the next slide. The blue arrow is pointing to a bare pinkish needle-like inclusion in the cytoplasm of a myeloid. There is an auroid. Finding even when auroid is acute myeloid leukemia, it is one of the most important findings in bone marrow or peripheral smear examination. Thank you so much for joining and keep you the great work, and I see you in the next session.